Yeah, you're probably wondering why I'm I'm so informal today with a tracksuit. The reason is injections. It means I don't have to open up a shirt and all that. It's to let you see how to self-inject. And it's one of the things with cancer, people have to self-inject. It's to stimulate white blood cell growth after chemotherapy. And it's one of the big things that people say, I can't do that. I definitely can't do that. And I remember when I was first shown, it was my first chemotherapy, and I came back the next day and the nurse said, right, we're going to have to give you an injection, and then you're going to go home, and the rest of the week, for 7 days in total, you're going to inject yourself. To which I said, you're serious? And she said, yes. And she gave me a little red ball and said, there's a red ball, inject it. So I'm sticking and thinking, yeah, this is easy, I don't feel a thing. But it's not the same thing when it's your belly. So off we went anyway, and did the injections, and came back the following week to get tested. And I kid you not, you put it in your stomach, you can put it in your arm or your thigh, but I always put it in my stomach. And there was another guy there, and I was checking with him, and he had all these bruises around his stomach, the same as I had. And I said, hang on, that's a bit, there has to be an easier way. I've actually got a meme up on Facebook, I think it's on Twitter as well, and it's Bill Gates saying he always gets a lazy person to do the job because they always find a way to cheat. And right throughout all my business life, I've always found a way to cheat, and this is no exception. So I'm not going to talk about it, I'm going to actually do it and let you see me doing it. But what I discovered was if you just push it against the skin and wait, it goes in really easy. Okay, so if you're getting granosite or nitrogen injections, they will give you a syringe and a needle. Now, this is old technology. This is new technology. This is old technology. But here's one of the new needles. And what you do is simply open it up. Now, they will give you a proper connector. This one it'll go in, but it won't stay and it won't fit. But for you, when you have your syringe on and ready to rock and roll, you simply pull this back and remove the sheath. Oh, there we go. Now I doubt if I can, maybe I can focus on it. If you can see this tip end here, yeah, I'm doing it through the camera so I can't even see it, but you'll see that the opening is at the top. So if you have it like this, with this coming up and down, this means it goes in a heck of a lot easier when you push the injector in. We call it injectors, we do not call them the N word because the brain doesn't like the N word. Once you're finished with it and you've got it back out again, you simply push that over, and when you hear a click, I can't do it because it's not on a, yeah, that's it. So that's your injector, completely safe. So I'm going to be unwrapping this one shortly, and I'm going to be giving myself an injection. You're going to see just how easy it is. The hardest part of doing the injection is getting the needle through the skin. So this is going to sound maybe a little bit childish to you, but bear with me. All you do, I can hardly see what I'm doing here because I'm standing, is you put the needle on the skin there, it's just touching. That's it. That's the whole thing. Now the needle's not in, obviously. I'll go back a little bit. If you now think about doing something, pushing it in, don't. Just rest it gently on the skin and forget about it. That's the main part done. Now what happens is, the skin sends a message to the brain and says, look, there's something sticking into me. What should I do? And the brain says, oh, hang on, that's one of those injectors that'll make you better. So what you should do is let it in, and the skin then decides to open and the needle simply goes in. Now, it might take 10 seconds, 15 seconds, 30 seconds, a minute. It doesn't matter how long it takes. Now I mean, you can see the indentation, I think, on the skin, I hope. I'm standing over it, so it's pretty hard for me to see. You just push it against it gently, 45-degree angle, and you wait. That's it in, isn't it? Yeah, seems to be, yeah. So that's the needle in. Yeah, we don't call it a needle, sorry. That's the injector in. Absolutely no pain. There will not be any bruising there. It isn't it? Yeah, it is, it is. That's it. I'll show you afterwards what you do with the injector, but once it's in, you've got to take it out again. Now some people just whack it out, just pull it out in one movement. Be reverential about it. Take the injector out gently. Very gently. Let the skin release it. And there we go. When you're doing it, when you've actually got it in, it's 1, 2, count to 10, and then count to 10, ever so gently. If you push it in all in one go, count to 10, you will get a bruise. And the thing about it is, if it's a one-off injection, count to 10, it doesn't make any difference. But where you're getting an injection every day for 7 days, little tiny pushes, and that's it, finished. And you will not have a bruise the next day. So to show why you shouldn't inject quickly, this is a tomato, just an ordinary standard tomato, nothing special about it, and this is blackcurrant juice in the injector. And what we're going to do is just simply inject the tomato, but we're going to do it relatively quickly. Now I think you can see what, in fact, you have actually got the teeniest little split there, which is where the tomato, yeah. So if you can imagine that being your skin, and you just pop it in and squirt it in one go, the cells under your skin are going to expand rapidly, and you're definitely going to get a bruise. So, new tissue paper, the stains underneath, and new tomato, brand new tomato, exactly the same as the other, well, not exactly the same, maybe they were brothers, but just a new tomato, okay? And what we're going to do this time is inject it. Same thing again, blackcurrant juice with the injector. What we're going to do is put it in, only this time we're going to do it very slowly. Just hasn't actually done it, hold on. Just a little bit at a time. The way I recommend that you do it. Oh, it's dripping. Is it working? Well, it hasn't split, that's for sure. It's dripping a little bit. That's nearly it all in. Now, of course, the tomato's got a fairly, let's say, not hard skin, but it has got a solid skin. Let's just give it a little dry off. Yeah, the skin has not split. There is no split in the skin. Now, in fairness, it didn't all go in because there is some stains here, but no split compared to this gadget. Yeah, I think you can definitely see the difference there. Another piece of advice cancer patients are given is to pinch the skin. So you get your belly, for example, and you pinch it, which means that you're pinching the bottom bit, and at the top bit it's sort of bulging out a bit like a balloon. Now that causes pressure, and the one thing we don't want is tension or pressure in any aspect of cancer. So just to demonstrate, once you pinch the skin, so if you can imagine it being pinched here and pressurized at the top, once you put your injector into play, yeah, that's what happens. Now, obviously your skin is not going to explode. I mean, we all know that. But what happens is you're pushing it into a pressurized area at the top, That's not good. That's going to cause a bruise. And then you're pushing it through a pinched area, which is actually tightening the skin, and then you're pushing it further in. That's not good, and you're guaranteed to get a bruise. So that's why my method works a heck of a lot better to avoid the bruises. But just to give you some idea, that's the amount of granosite for, I would suspect, without counting them, one chemotherapy regime. Why I didn't take them back, I have no idea. I can only assume it was so that I could show you. So the second time I went back to the chemo centre, and I seen the same guy again, and he was saying, oh, look at the bruises, look at the bruises. And I was saying, funny enough, boom, look no hair, look no bruises. And he said, how do you do it? So I told him. And I think it was the fourth time, he told somebody else, and they told the nurses, and it became a standard thing. Do not jab it in and pull it out. Don't stick it in. The brain doesn't like to hear that. Don't stab it in, because you stab somebody with a knife. The brain doesn't like to hear that. Call it an injector. Don't use the N word for this bit. It's an injector. The brain doesn't mind that. But when it hears the N word, doesn't like that. That means pain. That's associated with pain. We don't want that. So it's an injector. And the other thing is, when you do it, especially the first time you do it, you feel great, because you are participating in your own cure. And it's a theme in my book: participate in your own cure. Do what needs to be done to get out the other side. Now, it should be participate in your cure, because it's your own cure. You don't need the word own. But I prefer that. Own it. Own it. Do what you need to do. And I remember, and don't cheat. I remember once going to chemotherapy, and we were all discussing it, and this guy said, I just did the first one. Why? Why would you do that? You're getting chemotherapy to save your life. You need these injections to boost your white blood cells. And this dickhead gave himself one injection and couldn't give himself any more. Why would you do that? Participate in your own cure. Take control. Give yourself the injection. How many people do you know give themselves injections? Once you do this, and it's a simple little thing, you'll be embarrassed after you do it the first time, but once you do it, you'll feel like a god. You're the only person that does this. So participate in your own cure. Follow what I told you. Do it nice and gentle. Do not rush it. There's no rush. Take it nice and easy, and there's no pain, no hassle. It's easy peasy. Hope that helps.